Hi everybody, Dr. Joseph Cipriano here, and today we have our patient. How are you?
Doing well.
Doing well, okay. Now I know this is the second time.
Mm-hmm.
How was the first? How have things been going?
The first was great. The Y strap was life-changing. So my back has been killing me because this baby lives in my ribs, and so I've just dreamt about that Y strap since probably I started my second trimester. So.
Gotcha. And now you are 27 weeks along.
27 weeks.
And you have twins.
Twins.
Twin boys coming, so congratulations.
Thank you.
Alright, what I want to do first, I'm going to have you lay on your back. I just want to get check the leg length, check a few things out. There we go. So we go ahead. So she's pulling short on this side here. That hip looks like it's going up as well. Let me have you. I gotcha. Let me have you. Yep, I'm gonna have you come up. I gotcha. Perfect. All right. Any pain or tenderness going on?
In the first trimester, my neck was awful, but it got better and then turned to my back in the second trimester.
Okay. And so now today's a lot of like mid-back, correct?
Mm-hmm.
Okay. And where were you feeling that again at?
On the right side, like literally opposite of where he lives, right here.
Okay. Let me go ahead. We're going to use the massage device first. I just want to relax things, and then we'll start with the adjustment. Stay seated there. Over here. Good. So yes, I mean, as you guys can tell, we've got to change up the routine. Because obviously not having you lay flat on that stomach at all. Let me have you stand up.
Okay.
And I'll have you face your back to me. Yep. Good. Bring your hands over right. I'm going to lean you back just a little bit. Squeeze your elbows together.
Oh, wow.
Good. Okay. Next one, what I want you to do, I want you to have the sit with one leg on either side. So it doesn't matter if you face either way, but. Okay. Raise that up and over. Yep. Keep your thighs to the table. I'm going to rotate you like this. Look over the shoulder for me. Gotcha, just a little bit right in the middle here and the left. Good. Okay. Let me have you actually sit here, but face like turn completely around.
So face this way.
Yes, please. Thank you. Bring one arm up and over. The other one up and over. Take a deep breath in and exhale out. Good. Come on up. So what I want to do, I want to check the leg length again.
Okay.
So we'll have you going back. A lot better. Still a little bit short here on that side. Relax your legs for me, okay?
Oh, wow.
Good.
Up? No?
No, what I want you to do, we're going to lay on your side.
This way?
Yep. So you can face me first.
Okay.
Good. And I'm just like that. Perfect. Good. And then I'm going to have you flip to the other side.
Okay.
Good. And then flat on your back. So now we're going to do the Y strap.
Okay.
So I'll have you come down just a little bit.
Okay.
Perfect, right there. How are you feeling?
Good.
Okay.
The leg pulley thing
Yep.
felt really good.
Good. And lift your head up. And down. Good.
What do I do with my hands?
Rest them on your stomach. There we go.
Oh my gosh. That's amazing.
Okay. And relax. Deep breath in and out.
That feels all the way down. That's so good. Like I've literally just, I'll dream at night that somebody has my feet and somebody has my head and then they'll just pull in opposite directions just for that feeling. Oh, thank you.
Good. You are welcome.
Oh,
And relax right there. Feeling better?
yes.
Good. How's everything feeling?
So good. Really good.
Good. Good.
Like I feel like I can breathe.
I'm glad. And well, obviously, you know, it's just
Yes.
with twins,
Yes.
unfortunately.
And everything's been right here, so it just pulls me forward, so it just feels good, like it's the first time I've been able to sit up straight.
Good.
So, thank you.
You're very welcome. I would say keep me updated with how things are going. Obviously, you don't have that much longer.
Mhm.
I know you're second trimester right now, so usually twins come a little bit sooner
Mhm.
than normal, but keep me updated if you do need to come back in one time before.
Okay.
Completely fine. If not, a kind of goal would be to see you after you give birth.
Okay.
So after you give birth, give it a couple weeks and then
Okay.
coming on in just to make sure everything gets put back to where it needs to
Right.
be.
Right.
But good. How you feeling?
Wonderful.
Perfect. I'm glad.
Thank you.
Very
Thanks.
welcome.